Welcome to It's All Mental, a podcast from Everyturn Mental Health. Mental isn't a bad word. There's no health without mental health. We're here to talk about every high and low, no limits, just good conversation. Hello everyone. In this episode, there is a mention of domestic abuse. Please stop the episode now if you'd prefer not to listen to this topic. Welcome to episode 5 of It's All Mental. I'm joined by Julia today, and we're here to talk about EMDR. I'm really excited about today's episode. From what I understand of EMDR, I think it's a really fascinating topic, so I'm really looking forward to find out a little bit more. Welcome, Julia. If we can start by you telling us a little bit about who you are and what you do.
Okay, so I'm excited too about this because I'm very passionate about EMDR. So I currently work as an accredited CBT and EMDR therapist. My name's Julia Westhead. Here's my lanyard. I'm working for Everyturn Mental Health, hence the purple. And I've been with this organisation for nearly 7 years. So I'm part of the Derbyshire team and I'm based in the High Peak area.
Wonderful. Thank you, Julia. Well, yeah, very well qualified to talk all things EMDR. Thanks so much for joining us. If we can start by you telling us a bit about what EMDR is, so what the letters stand for, and yeah, a little bit about what it's all about. That would be lovely.
Okay, so I'm going to start with what the letters stand for because that's the short answer. So they stand for, are you ready? Eye movement, desensitization, and reprocessing, which is, of course, a bit of a mouthful, hence we say EMDR. And the question, what is it? Okay, so it's a therapy that helps overcome difficulties, difficult memories by using what we call bilateral stimulation. So bilateral just means both sides, left, right, left, right. So we're using both sides of the body. And it can be eye movements, or it can be tapping, more about that later. And the person who comes for treatment, they'll make some kind of bilateral movement while focusing on a traumatic memory. The big question that people ask though is, how does it work? Okay, so that's the big question. So I use a filing cabinet analogy to explain how it works. So think very simplistically, imagine that our brains are split into 2 filing cabinets. So you've got the short-term memory filing cabinet and the long-term memory filing cabinet, and imagine a conveyor belt in between the 2. Something happens, an event in the short term, pops into the short-term memory filing cabinet. And then under normal circumstances, it travels nicely along the conveyor belt and lands in the long-term memory filing cabinet. Now, at any point, we can access our long-term memory filing cabinet. We can open that drawer and we can go, oh, do you remember that holiday we had? Or something maybe less positive. Oh, do you remember that time you fell off your bike when you were 5? So that's how memory kind of very simplistically normally works. But when something really traumatic happens, the memory can get stuck in that short-term memory filing cabinet because it's stored alongside the associated emotion and the physical response that our body has to it, because our bodies actually remember bad things that happen to us. And consequently, those memories, those traumatic memories, stay in the short-term memory filing cabinet. And that's why they have this real sort of immediacy. It can feel that they are still happening or they are happening right now. And some people can have some really distressing nightmares as well. So that's what EMDR does. It works with those memories and helps to get them along the conveyor belt and filed away in the long-term memory filing cabinet.
Wow, that's so fascinating. And I love the analogy of the conveyor belt and the filing cabinet as well. That's a really interesting way of thinking about it. We actually had a previous episode on anxiety with Mona, and she talked about where that comes from in terms of the central nervous system. And she talked about kind of an oak tree analogy, which was also really lovely. And similar things, how those kind of events that can happen within our lives can stay with us, and then they can still have an effect on us much later. And I think that really links to what you're talking about in terms of how they're still kind of filed away within side of our bodies.
That's right. Yeah, absolutely. Yeah.
And how long has EMDR been used for? And do you know kind of much about how it started and where it all came from?
Okay, so just a little tiny bit of history. In 1987, an American psychologist called Francine Shapiro, she was walking through a park and she just had some distressing news. And she noticed that as her eyes moved from side to side, she got some kind of relief from the distress that she was feeling. And she discussed it with colleagues and said, let's give this a go. This is me paraphrasing, by the way. And they had a go and they also found a positive response to it. So my understanding is very much like, well, this works, but we're not quite sure how. Then since then, there's been, research and trials and that kind of stuff. And I couldn't actually find exactly when it was introduced to the UK, but at some point, EMDR became a therapy recognised by the National Institute for Health and Care Excellence. That's what we know as NICE. So it's mentioned in the NICE guidelines in the UK.
Oh, wow, that's fascinating. And again, I guess there's a link to nature there as well, isn't there, in terms of kind of where it started and being, being outdoors and within nature, which is really interesting. Fabulous. And what is it used to treat? So kind of who would be suitable for EMDR, and is there anyone that it wouldn't be suitable for?
Okay, so it's most widely known for treating traumatic memories for people with perhaps a diagnosis of post-traumatic stress disorder, which we know as PTSD. And that is what a lot of people think it's for, and that's where it stops. But that's actually not the case, because it can treat many, many different problems. It can be used to treat phobias, things like obsessive compulsive disorder, OCD, social anxiety, body dysmorphic disorder, when people see things in their body quite, in a slightly distorted way. It can be used for lots of different things. And the reason for that is a lot of mental health issues can be traced back to a significant memory. Something difficult's happened. Bullying's a classic example. Witnessing domestic abuse in the home, that's another example. Bereavement. So what EMDR does, it really gets to the root of the problem that could be manifesting as something else, and we see some really, really good results from it.
Wow, that's amazing. It's a huge amount. It's really interesting. It's like you've said, my understanding was that it's very much kind of on trauma and PTSD.
That's right.
That's how I've heard it being spoken about. So it's really interesting that actually there's a much wider range of things that it can really support with.
Yeah, absolutely. And it can be used to treat adults and children. The children's training is a separate thing. So I'm only adult trained. And I would say for most of the people that I have seen since I trained, well, coming up for 4 years now, 4 years ago, for most of those people, it has been suitable. So it's always worth saying, I think, that we have to assess risk. So, in the question, who is it suitable for, we need to make sure that the risk is fully assessed, especially as what we're doing is we're opening up some really difficult memories from the past, and people can respond in different ways to that, because a lot of it is actually it's been buried for a very, very long time. And for people who are undergoing EMDR, we need to make sure that there are robust support systems in place. So if people disclose thoughts of hurting themselves in advance of treatment, it doesn't mean that they can't have treatment, but it really does need to be monitored and considered. And you also asked about, is there anything it's not suitable for? Okay, so we are advised not to use it with people with certain neurological disorders. So, for example, migraine. I mean, just the eye movements, which I'm going to talk a little bit more about. It can really make your head feel quite strange. So, somebody who's got anything like that, it's not necessarily recommended for. And also, pregnant women in the first and third trimester. But everything is taken on a case-by-case basis. And for example, if a pregnant woman is severely traumatized and the trauma is more detrimental to her pregnancy than EMDR, we would potentially go ahead. So it's all case by case.
And can you tell us a bit about what an appointment would look like? So if you've decided that EMDR was for you and you wanted to work with a therapist through it. Can you tell us a little bit about actually what happens within the therapy room? That would be lovely.
Yeah, because it's so mysterious, isn't it? What is this
Yeah,
EMDR?
like
what is? Yeah, well, to be fair, I the other day somebody said to me, I thought you were some kind of ninja Jedi. What have you? I have people say, "What have you done to me?" In a positive way. This is like, what is going on here? So yeah, what is this EMDR stuff all about? So it follows quite a strict protocol, but of course, different therapists will make their own little tweaks. But it would go something like this. So for me, session 1 is tell me your story. In EMDR speak, it's called history taking, but I just say, tell me your story. This is your session. Tell me what's gone on for you, what's significant, what's important. And that's when the traumas will come out. And the beauty of EMDR is they never have to tell me again. And that's it. They will be bringing up memories in future sessions, but they never, ever have to talk about it again if they don't want to. That's one of the lovely things about it. And I'll also give them an explanation about EMDR. Perhaps use the filing cabinets like I've done to you, and a little bit about how anxiety and trauma affects us, how it affects the body. And I will always say, though, just try it. Just try it. Give it a go and see what happens. And please try and keep an open mind about it. So that's appointment 1. The second appointment focuses on giving resources to deal with any distress that might become apparent, or that might, as we start to open things up, people might start to struggle with. So that will be things like breathing techniques, perhaps helping people to find some kind of happy place in the mind, to take themselves off to. I'll show you very briefly one. It's called the butterfly hug. And so it's literally make your butterfly, put your fingertips just below your collarbone and slowly tap. It's amazing. It's just so lovely. I could sit here all day doing this. Okay, so that's one of our resources. You've got that for free, everybody. And other sort of similar exercises to help people just to be able to find their calm place. And then all the appointments after that, whether it's 2, 4, 6, however many, will be specifically processing the memories. So what does that look like? As briefly as possible. This is very, very carefully set up.
Yeah.
So the person will bring a memory to mind and will be encouraged to notice certain things about that memory. And as they are doing that, they will be doing eye movements. Now, I was taught, my training is that you watch my fingers moving from side to side like this. Really hurts your shoulder. I have to say that really hurts your shoulder. And in lockdown, we had to become more creative. So I don't always do that for the sake of my shoulder. The easiest way remotely is, as I'm looking at a laptop screen now, okay, I'm looking from side to side, my laptop. People are very creative. They'll stick things on the wall. They'll look at oranges from their fruit bowl. I've had all sorts of things like that. So the eyes are moving side to side, or tapping. So right, left, tapping, fast butterfly. And that's what the bilateral stimulation is. The eye movements work the best. Sometimes we combine tapping and watching your hands. And it is a little bit like, what's the old thing about rubbing your tummy, patting your head, or the other way around? It can feel a little bit like that. But what happens is the memory, in very simplistic terms, is sort of forced because you're focusing on the past and the present at the same time. The memory is sort of forced out of that short-term memory filing cabinet. It has to go along the conveyor belt, and then it's stored better in the long-term memory filing cabinet. And what that means is that something has changed. So it doesn't feel so distressing. It doesn't feel so upsetting. Any images that people might have had that have been really disturbing them, they might become pixelated. They might just become less clear. The memory is still there. It doesn't go away. And it's not hypnosis, by the way. I want to be very clear. But the memory is less immediate. And what I say to my patients, which isn't, it's not very professional, but it's what I say it's less in your face. Because the memories they're just in the face. It's less in your face. So hopefully that explains what an appointment looks like. Might make it a little bit less distressing for people to come. We always end calm. So we might have opened up memories. We always bring everything down at the end just to make sure that people are in their calm space before they leave an appointment.
Yeah. Thank you, Judy. I mean, that's so fascinating. Like, one, just understanding more around how it works, how that memory can be processed in that different way. That makes so much sense. And also, just for anyone who's thinking about, looking into EMDR themselves,
Mm-hmm.
I think it's just really useful to kind of have a really good understanding of actually kind of what the sessions would look like. So yeah, thank you. Yeah, that's really, really useful. Just a couple of questions to finish up. Have you got any examples of the effectiveness, any kind of particular cases that you've worked in where you could describe kind of how it's been effective?
Okay, so as I said before, so it's that sort of mysterious thing. Lots of people come quite cynical, and that's fine. That's absolutely fine. I think I probably was myself before I trained in it. So without sort of being too specific, because of confidentiality, I've seen really good outcomes. People who've been traumatized by watching domestic violence as children. And everything just changes in that memories, because you see that as a child, and very often those people have taken on board, I should have stopped it, I should have done something about it. And what EMDR helps to do is sort of change that way of thinking about the memory. Yeah, I did all I could, I was a child. That's that kind of thing. I've seen people recover from cancer trauma, bullying trauma, people who have been helped with the trauma of losing a loved one, still the grief, but the actual traumatic circumstances. One particular example I can think of is a lady who'd lost her beloved pets in very traumatic circumstances, and she was massively, massively helped by it. So just keep an open mind, I say to those people, and give it a go. And for most people, I haven't got 100% success rate. Who has? For most of those people, they just say, wow, that has just changed absolutely everything.
Yeah. And again, I think it's really interesting because there's some things you're talking about there, which, they feel really significant life events, traumatic events that could have happened to people. But there's also things which people might not have thought of, that, not to say that they aren't traumatic in a way, but I guess it's whatever's really personal to that person. And if it's something that's affecting somebody, it's having an ongoing impact on them, then it's something that they could consider. So
yeah, trauma is everywhere. Lots of people have got traumas and perhaps don't even realize that they've got traumas.
Yeah, definitely. Yeah. And lastly, can you talk to us about how someone would go about accessing a therapist who uses EMDR as a tool? You've said you've sent us some recommended resources, so we'll make sure that's in the podcast notes. Thanks so much for that. But how would someone go about making those first steps to access EMDR?
Okay, so if they want to access an NHS talking therapy, absolutely any adult can do that with self-referral. So you can go through your GP, or you can do it yourself. And the easiest way to do it really is if you just Google mental health services in my area, and they'll come up with, there'll perhaps be 3 or 4 providers. And you'd find a service like ours. So we're Everyturn. So I'm based in Derbyshire. If people are in Derbyshire, we would be one of the options. We're not the only option. We're the best. I have to get that one in, of course. But sorry about that. You might need to edit that one out.
No, that's fine. We are.
And you can refer online. You can refer over the phone. Just to sort of say, just to stress, you don't have to go to your GP. You can just Google it, find it, do something online like that, or ring. And the only thing I would say is that if you want EMDR, and then there might be a big deluge of people wanting EMDR now, but you might have to specifically request it. You're less likely to be put forward for EMDR than other therapies, so you might have to actually ask for it. If you want to know about therapists in the area, people might be considering going privately, or just want to check out who's out there, who's accredited. The EMDR Association has a list. So you put your area in, you put a name in, however you want to do it. You can find a therapist in your area and contact them through the EMDR Association.
Brilliant. Thank you so much. And thank you so much for that conversation, Julia. I've learned so much. I know it's going to be really interesting and useful for the people who are listening. So thank you so much. Thank you for listening to It's All Mental, a podcast from Everyturn Mental Health. If you enjoyed this episode, remember to follow, rate and share. See you next time.